In the postpartum period, and certainly in pregnancy as well, our bodies are changing so significantly and so constantly that it's hard to know what could be normal or not normal. In the postpartum period, things that we certainly want to hear about are any sustained fevers or chills, general feelings of unwell, dizziness, lightheadedness, unusual headaches or loss of field of vision, pain under the ribs on the right side. Those are some things that could be a sign of preeclampsia or blood pressure issues, and things that we want to hear about.
Usually in the first few days after you deliver, you're going to have heavy bleeding, regardless of whether it's for a C-section or vaginal delivery. This will slowly change over the next week or two and become a lighter red, and sometimes be mixed in with some vaginal discharge. Then it will change to more of a discharge, which can be yellow or white, but bleeding can last up to 6 weeks, and that can be really normal, even for some people up to 8 weeks. So watching how much you're bleeding. If you're having clots greater than the size of a quarter, that's a reason I ask people to call in. If you're bleeding through a pad in an hour, that's another reason I ask people to call in. And then if you start getting dizzy because of your bleeding, that's another reason. We monitor closely and we watch out for this because bleeding is a normal part. The other thing I like to tell people is as you get more active, getting up, moving around, you can get a slight increase in your bleeding, and that can be normal. If one leg is swelling and looks like an elephant and the other leg looks normal. Due to pregnancy, we have a slightly high chance of getting blood clots in our legs, which can continue after we've delivered. It's normal for both legs to be a little swollen for 1 to 2 weeks, but if one leg gets swollen and doesn't, that can be a sign that you have a blood clot in your leg. If that shows, then giving us a call or going in to be evaluated is recommended. If you start to feel suicidal or like you're going to hurt yourself or you really don't feel right, then coming in to be evaluated is recommended.